So before you start your weight loss journey, I would like you all to do few things that you can do very simple at your home. So you need three things, basic things, but you can add more as things goes on. So I will start with basically measurement tape, and also a weighing machine like this, digital weighing scale, and then you can have simple either iPhone or Apple Watch or Fitbit, any kind of device that can measure your steps. So let's start with this measurement. So in order to calculate BMI, we need height and weight. So I would recommend you to weigh yourself at least once a week. I do personally every day, but you can do once a week. Your blood pressure is another important measurement you need to keep your track of. So I would recommend at least to track of your blood pressure 2 to 3 times a week, and at least a weekly blood pressure measurement. Your blood sugar is also important part of your measurement. If you have diabetes, I would highly recommend you measure very closely during your weight loss journey. And your body mass index, I'll be covering more details in few minutes. And last thing, steps. So your steps, I measure my steps in my Apple Watch. You should be aiming towards about 10,000 steps a day. Somewhere between 5,000 to 10,000 would be ideal. So labs we're going to start with today would be a cholesterol, also known as lipid panel. We can monitor this every 4 to 6 months or twice a year. So basically we look for a few things. I will focus more which one is very important. So if you see this here, the triglyceride, which should be less than 100. Your good cholesterol is also known as HDL, should be around more than 60. And your bad cholesterol, which is called as LDL, should be less than 70. And the total cholesterol should be around less than 200. So more than that, I will focus something called ratio, which is ratio between your triglyceride and the good cholesterol. And if you see there's a ratio between those should be less than 4, and also the ratio between the total cholesterol and your good cholesterol should be less than 3. The good way, or the very best simple test to see if you are risk of having either insulin resistant or more like a complication of obesity, which is diabetes, to see in triglyceride and the HDL level. So if your HDL is low and your triglyceride is high, and that means it's not good. So by losing weight, you will improve these numbers. The second we'll talk about is thyroid. So thyroid is also basic blood test. We can do this every 4 to 6 months again, or once a year. So the basic test thyroid, and you can also do something called 3 and T4, and some antibodies called thyroid peroxidase, which your doctor can order for you. Other tests we can do. The next test you can do is your fasting blood glucose. So fasting blood glucose is also a very easy test, and when you should be targeting about less than 100 fasting blood glucose to make sure you're heading the right direction. The other tests you can also include for your weight loss journey would be insulin level, and this is also very important test to make sure you don't have insulin resistant. If you have high level of insulin, then it's not good for you. So your levels should be at least less than 10. So these are a few tests you can do. There are some special tests we can discuss next video about especially cholesterol and something called insulin resistance score, which I'll be discussing in the next video. So one of the very common labs which we should be tracking is called A1C, or hemoglobin A1C, and the goal should be around less than 5.5 to be normal. And I would do this at least once or twice a year. So next we're going to talk more about BMI, which is also known as body mass index, which is basically your weight in kilogram divided by height in meter square. So before I go to what is normal BMI and what is considered as obesity, let's talk about why this is important and what actually we are measuring. So basically, in the human beings, there are certain things that gives the weight, and most of the weight is coming from the muscle. If you see this box here I've drawn, and the rest of the weight is from your fat, your bone, some of the blood, and other part of the body. So in order to have a accurate picture of your whole body weight, I think the most important thing here is to focus on your fat, which is especially your central part of your body called central obesity, which is not good for your health. So you need to focus on that and not only on muscle. So for example, if somebody is athletic or do bodybuilding, their muscle mass will be more and their fat will be less, even their BMI is high, but overall their health is pretty good compared to somebody who has high fat, especially in the central part of your body. So what is normal BMI? So if you see this diagram here, I've shown here, somebody whose body mass index or BMI less than 18.5 is underweight. A normal body mass index is between 18.5 to 24.9. Anything above 25 is overweight, especially the Asian population or South Asian people. Even the body mass is more than 23 is they're overweight. And if somebody's body mass index is more than 30, which is considered as obesity. So there are three classes of obesity. Between 30 to 34.9 is class 1, and 35 to 30.9 is class 2, and body mass index more than 40 is extreme obesity. So this is very useful to understand where your body mass index is, and you can usually, when you go to routine physical exam, or you can calculate yourself by different apps to monitor this as a part of your weight loss journey. How accurate is BMI? So when you do the body mass index, most of the time it does not tells you how much fat you have or how much muscle you have. So in order to get an accurate estimation of your fat in your body, there are certain other things you can do or measure accurately. So simple things like waist to hip ratio can give you the accurate measurement of how much your body obesity you have, and also something called waist to height ratio. So basically, in short, your waist should be half of your height in inches. There are accurate measurement that you can do, also called DEXA scan, which is very expensive test, but you can measure your body fat and where the fats are. And also there's something called calipers, which you actually there's a device that you can get and actually check the thickness of your fat in your belly and other parts of the body. And the last thing is MRI and CAT scan is also very useful to measure your body fat composition. So another easy way to monitor your body fat besides body mass index is waist size or waist circumference, which you can easily measure with a simple measuring tape. And for the men, I would the normal should be less than 40 inches waist circumference for the men, and for women should be less than 35 inches. So I just want to talk about a little bit more about waist to height ratio, which is also very important and simple measurement you can do with a simple measuring tape. So basically you need to measure your height and your waist in inches. So when you measure that, so basically this is for the woman and the ratio between the men. So here you focus on two things. One is your for the woman, the normal is 46 to 48, and for the man is 46 up to 52. And the last thing we'll focus in obesity and also extreme obesity. So for the obese is 54 up to 58 for the woman, and for the man is 58 to 63. And the last thing to focus here is about if your ratio is more than 58 for the woman is extremely obese, and if the ratio is more than 63 for the man is extremely obese. So this is very simple and accurate way to measure your body fat and overall your health status compared to BMI. So with that, I'll see you next week. We'll talk more about the obesity, what is obesity, what is the real cause of obesity, and complication of obesity, and with the disease which you can get from being obese. Or we'll see you next week. Thank you for watching.